So these are the threats in the world at the moment because particularly of diabetes and hypertension, and mainly as a result of obesity. And what causes obesity? All of us know: lifestyle disease, lifestyle problems, lack of exercise, poor diet, and of course a genetic predisposition as well. As Minister of Education, I am pleased to participate and to be part of a multi-sectoral and intersectoral relationship and moving with the Honourable Prime Minister's wishes of us moving this process forward. And she is in fact carrying it to the United Nations as well in September, as you heard. And the Minister of Health will also be part of this process where we will be participating in worldwide discussions on this issue. But from a Ministry of Education perspective, I have been working assiduously on this issue for a long time since I came in. And I want to indicate to you that from the position of prevention, we are now strengthening the curriculum from infant year 1 straight up to primary school level, the end standard 5, to ensure that physical education, health and family life, and nutrition, and some degree of agri-science become an important part of the curriculum and to be continued to be taught up to standard 5, no longer up to standard 3, which is where it is not examinable. What is not examinable is not taught. So how are we impacting on this in this country on this preventive aspect? We have 250,000 children in the schools, 126,000 primary school students, 86,000 secondary school, and about 7,000 in early childhood education centers in the formal system, and close to 30,000 between ages 3 to 5. We have almost 900 schools, 152 secondary schools, 473 primary schools, and about 200 early childhood education centers. And we have 15,000 teachers, 3,000 public servants, 800 contract officers. So if we start the education right there in the Ministry of Education, with 250,000 children and at least 2 parents in a family, some will have 1, we impacting about 750,000 of our population just from the Ministry of Education. So when we carry the right values and the right information and education to our children, that information is spread to the parents and therefore to the wider community, and therefore prevention by education become an important part which the Ministry of Education will do and will continue to do and will improve our aspects of education by our children. We are also engaged in the provision of meals for children. This People's Partnership Government under the Prime Minister, Mrs. Kamala Prasad-Bissessar, has continued to work assiduously to improve the lives of our children and make sure that the children do not suffer from malnutrition and that their diet and nutrition is adequate. We spend $1.2 million per day on school meals, providing school meals for 861 schools, including 188 preschools, 144 secondary schools, and 472 primary schools, and 57 special schools. And we provide 97,173 lunches every day for our children, and 56,369 breakfasts. That is an important consideration of spending $1.2 million per day on school meals. And I have mandated the National School Dietary Services Limited to investigate and to analyze the contents of the nutrition in these school meals and to ensure that there is a variety of complex carbohydrate, protein, and vegetables. We are working closely with the Ministry of Food Production to ensure that most of the contents in these are locally produced, to ensure that we safeguard our food industry.